Imagine three children walking into your pediatric dental clinic. Child A has no obvious disease, but when you take the history, you identify several risk factors. Child B has an early disease process that has just started, and child C comes to you with established disease and symptoms. Now, let me ask you one simple question. Should prevention look exactly the same for all three children? Obviously, no. But why? And more importantly, what exactly do we mean when we say preventive pediatric dentistry? Is prevention simply brushing instruction, fluoride, and sealants? Does prevention begin only after the first tooth erupts? Is prevention the dentist's responsibility alone? These are the questions we are going to answer today. And as always, on Tiny Teeth Talk, I am not going to give you a list that you can memorize for an exam and forget tomorrow. We are going to build the concept from the foundation. And at the end, I'll also give you a topic wise reading map, that exact book, chapter, or APD document you can read if you want to go deeper. So you don't have to spend hours searching through 5 different textbooks just to find the right paragraph. Let's begin with the bigger concept, preventive dentistry. The easiest mistake is to think that preventive dentistry means a collection of procedure like fluoride, sealants, oral hygiene instruction, diet counseling, prophylaxis. These are preventive interventions. But preventive dentistry is much bigger than the procedure themselves. It's an approach to oral health care. So this is the definition by American Dental Association, that preventive dentistry is the aspects of dentistry concerned with promoting good oral health and function by preventing or reducing the onset or development of oral diseases or deformities and the occurrence of orofacial injuries. So the basic idea is that instead of waiting for disease to become obvious then treating the consequences, we try to act earlier. So what does preventive really mean? So think of oral disease as a continuum: health, risk, early disease, established disease, and consequences. At different point on this continuum, our goal changes. Before disease develop, we try to prevent its occurrence. If early disease has started, we want to detect it and intervene early. If disease has progressed, we want to control the disease and limit its consequences. And throughout this process, we want to maintain oral. This is preventive dentistry. We do different approaches at different stage to maintain oral health. Now let's add one very important word, pediatric. As there is no official definition, we can understand preventive pediatric dentistry as the prevention and control of oral diseases and conditions in children through risk-based, age-appropriate, and continuous preventive care involving the child, caregiver, and the dental and healthcare. Let's break the sentence part. First is risk-based. Not every child has the same probability of developing disease, so preventive care should not be completely identical for every child. Then age-appropriate. A 6-month-old infant, a 4-year-old, a 9-year-old, a 16-year-old obviously do not have identical developmental needs. The definition is different, behavior is different, level of independence is different, risk factors are different. Therefore, prevention must change with the child. AAPD's current periodicity best practice specifically organize preventive recommendations according to age group and emphasizes individualized need and continuity of care. I will attach that AAPD PDF. Everyone should read each and every AAPD official policy and reference manual. Then continuous. Prevention is not something we do once. It is a process of assessment, intervention, monitoring, and reassessment. And finally, caregiver involvement. Especially in younger children, you cannot separate the child's oral health from the family environment. Who controls the diet, who buys the toothpaste, who helps with brushing, who decide whether the child attends appointments, who establish the daily route. The child may be sitting in our dental chair, but preventive environment extends far beyond the dental chair. Preventive include prevent disease, detect early, control progression, maintain health, and pediatric aspects means all these things are done with growth and development, developing dentition, observation, behavior, changing risk, caregiver involvement, unitely preventive pediatric dentistry. Why do we give prevention such a huge emphasis in pediatric dentistry? First, because of growth and development. Children are growing, their jaws are growing, the dentition is developing, their oral structures and functions are changing, so we are not treating a static system. To look developing dentition, the dentition itself is changing. primary teeth, mixed dentition, permanent dentition. Each developmental period creates different opportunities and different risks because some habits are forming. Childhood is when many behaviors and routines are established, like brushing, dietary patterns, snacking pattern, dental attendance, attitudes toward dental care, and these behaviors can influence oral health long after childhood. Then risk factors are change. A child who is low risk today may not remain low risk forever, and a child who is high risk today may become lower risk if we successfully modify the relevant factors. This is why preventive care cannot be a one-time checklist. Then caregiver influence. Children, especially younger children, depend heavily on caregivers. So when we are preventing disease in child, we are often also working with the parent or caregiver. Some early diseases affects quality of life, influences future oral health trajectory, and finally prevention during childhood give us an opportunity to influence the trajectory of oral health. We are not simply trying to prevent one cavity this year, we are trying to help the child move towards a healthier oral health future. APD notes that early recognition, prevention, and intervention can improve children's oral and general health and well. So, if prevention is our philosophy, what are we actually trying to accomplish? I am going to give you 10 objectives, but don't memorize 10 disconnected bullets. They actually fall into a logical sequence. First goal is prevent occurrence. Prevent oral disease from occurring whenever possible. Reduce risk factor. Identify and reduce modifiable risk factor. Then detect disease early. Detect disease at early stage. If disease has begun, prevent or slow its progression. Preserve healthy tooth structure and developing dentition. By prevention, promote appropriate oral health behaviors, educate the child and caregiver, maintain oral health as the child grows and develops, reduce the need for extensive or complex treatment whenever possible by educating and maintaining oral health, and with the help of all of these, establish a lifelong preventive attitude towards oral health. So if an examiner asks you the goals of prevention, remember, first, prevent the disease occurrence, reduce the modifiable risk factor, detect disease early, prevent disease progression, preserve healthy tooth structure, promote healthy behavior, educate the child and caregiver, maintain oral health through growth, reduce the need of extensive treatment, and establish the lifelong preventive attitude. Now we are moving from what prevention want to achieve to how a preventive dentist think. There is a two type of approach: disease oriented approach and prevention oriented approach. In disease oriented approach, the problem is that by the time the patient reaches the symptom stage, disease may already have progressed. And in prevention oriented, a prevention oriented approach ask earlier question. So in disease oriented approach, there is a disease, there's a symptoms, you diagnose it and you treat them. In prevention oriented approach, first risk assessment, prevent the modifiable risk, monitor. If there is early detection of any disease, early intervention will be there. So the best treatment is to prevent disease from occurring whenever possible. But please don't interpret this as a prevention means we don't treat. Of course we treat disease when treatment is indicated. The difference is that treatment is not where our thinking begins. Now let's convert the philosophy into practical principles. So these are the 10 principles. First, begin early. Don't wait for an obvious disease. Then second, risk based. The preventive plan should be reflect the child's risk. Individualized. The same age does not mean the same risk. Continuous. Prevention is a process, not an event. Evidence based. Choose interventions supported by appropriate evidence. Involve caregiver. Especially in younger children, caregiver involvement is essential. Monitor. We need to know whether the plan is actually working. Minimally invasive. Preserve healthy tissue and avoid unnecessary intervention. Educational. Knowledge and behavior are part of prevention. Comprehensive. Look beyond one tooth and one procedure. So when does prevention begin? The simple answer is early, before disease develop. We don't wait for the child to develop caries before we start thinking about prevention. For professional dental care, the APD recommends the first dental visit when the first tooth erupts and no later than 12 months of age. But prevention doesn't finish with the first visit. It is a continuous process. We assess the child's oral health and risk, provide appropriate preventive care, monitor the child, and then reassess as the child grows. Because a child's dentition, habits, and risk can change, our preventive plan should change with them. So remember, prevention starts early but it continues throughout childhood. And please don't confuse the question when does prevention begin with the when does a particular preventive procedure begin. Those are two different questions. The timing of fluoride, sealant, dietary counseling, oral hygiene instructions, or other interventions interventions depends on the individual child and the specific prevention need. We will study those separately. Now, whose responsibility is prevention? The easiest answer is the dentist, but the answer is incomplete. The child is at the center. As children mature, their ability to participate in their own oral health behavior increase. Then parents and caregivers influence the home environment, routine, diet, oral hygiene, and access to care. And dental team. The dental team assess, educates, provides preventive care, detect disease, and monitor progress. The other healthcare professionals, pediatrician, nurses, and the other healthcare professionals may contribute through health promotion, recognition, counseling, and referral. Then community or school and community settings can support oral health education and prevention. And public healthcare system, and at the population level, public health programs influence access, prevention, and health promotion. The pediatric dentist may coordinate clinical prevention, but prevention itself is a team effort. APD's workforce policy supports the comprehensive preventive and therapeutic care through a dentist directed dental home and recognize roles for appropriately supervised member of the broader dental workforce. Now let's introduce one classification that you will encounter throughout preventive dentistry. So level of prevention: primary, secondary, and tertiary. So primary prevention acts before disease occur. So the child is healthy, or at least we are acting before the disease has developed, and our goal is to prevent occurrence. Then secondary prevention focuses on early detection and early intervention. Disease has begun, but we are trying to identify it early and control it promptly. Tertiary prevention comes after disease has caused damage. The objective is to limit disability, reduce complication, and restore function. For this video, that's enough. Don't start memorizing some pediatric examples. We will have a dedicated video where we take actual pediatric dental interventions and place them into these levels, and we will discuss the areas where classification can become confusing. Now let's put everything together. Imagine you are sitting in your pediatric dental clinic and a child walks in. Don't start with which preventive procedure should I perform. You have to follow some steps. First is assess. Assess the child. What is the oral health status? What is the developmental status? And what are the relevant clinical findings? Then identifying risk. What factors increase the likelihood of disease or progression? Then which of these factors can actually be changed? Then educate the caregiver, the child, and education shouldn't mean giving a 20-point lecture to a parent. It means translating the risk into something they can understand and act upon. Now and only now we choose the appropriate preventive intervention, which is based on risk, age, development, evidence, and based on the child's individual needs. Then monitor. We monitor: is the child's risk changing? Are behaviors changing? Is disease progressing or stabilizing? Then reassess, because the child doesn't stay the same. Their dentition change, behavior change, environment change, their risk change. And then modify. So the preventive plan must change too according to the reassessment. And if there is only one thing I want you to remember from this entire video, it is this: preventive pediatric dentistry is not simply performing preventive procedure, it is managing a developing child with the prevention as the starting point. The procedure is only one part. The real preventive process is to assess, understand risk, modify what we can, educate, intervene, monitor, and reassess. Before we finish, let's revise the entire video in 5 questions. What is preventive pediatric dentistry? So prevent, detect early, control progression, and maintain oral health. Why children? Because childhood is a period of growth, development, changing dentition, behavior formation, and changing risk. When? Early and continuously. Who? The child, caregivers, dental team, other healthcare professional, and the wider community and public health system are responsible for this all preventive program. Then how? Assess, risk, educate, prevent, monitor, and reassess. If you understand this 5 questions, you understand the foundation of preventive pediatric dentistry. And before we end, I promised you something else. If you want to read this topic from the literature, I am going to save you the searching. You don't need to open 10 books and search for preventive pediatric dentistry in one. I will pin everything. That's our foundation. We haven't yet discussed fluoride, sealants, ECC, diet, or oral hygiene, and that's intentional because before learning what preventive procedures to perform, you need to understand how a pediatric dentist thinks preventively. In the upcoming videos, we will take each of those topics separately and go much deeper. But now, whenever you you hear the word preventive pediatric dentistry, I want you to think beyond fluoride applications or a sealant. Think child, think risk, think development, think continuity, think prevention. I'll see you in the next Tiny Teeth Talk video.